Hi everyone, thank you for watching the Compass Guide videos. If you have a friend or peer who needs help and is a newcomer into this country, into Canada, and is looking for a space where they can get help, you can share this video and our videos from the Compass Guide channel. Today, I am really honored and privileged to have someone who is a friend and is also representing the very important medical fraternity in this country. And without really wasting any time, I would like to bring him in. Welcome, Pradipto. Welcome to the Compass Guide channel.
Thank you, Shundip. Thank you for inviting me over.
Thank you, and thanks for making some time out of your very busy schedule. Pradipto is an assistant professor at UFT, University of Toronto, and he's also a staff pathologist with Toronto General Hospital and Princess Margaret Cancer Research Center. Uh, Pradipto, before we dive into some of the discussions that we were planning to have, and the idea, as I said, that the Compass Guide channel is mainly for newcomers and to give them understanding about different industries and different sectors in the Canadian landscape, and to give them a perspective which is an internal perspective, somebody who is already there in that industry, and give a little bit of highlight and things which they can then really take it and do something about it in terms of real help. And obviously, Canada, the medical side of it is a very important part of that whole triage when somebody decides on this country, whether you're as somebody who wants to be in this industry, as somebody as a practitioner, or all of us would always need the medical help. And some of us are coming from places where the medical system is very different, and the Canadian medical system attracts us. So before we dive into those discussions, why don't you give us a little bit of understanding of your journey, Pradipto, because you are an immigrant yourself, and if you could just give a little bit of about your journey.
Okay, so I kind of have a circuitous way back into medicine. And I also do have kind of like a long CV, which is not necessarily a good thing. But anyway, so just to sum it up, I did my med school in Calcutta from Calcutta Medical College. Then I moved to US and did a PhD in genetics, cancer genetics. I spent a couple of years in research, mostly cancer genetic research. That was from Hopkins and Sloan Kettering. So that's the time when I kind of decided to move back to clinics and took all the exams that you are required to take for getting trained in the US. And then I did my clinical training, which is about 4 years from Miami, University of Miami, and Sylvester Cancer Center. After that, I had 2 fellowships in hematopathology, that was again from New York, and lung pathology from Boston, Brigham and Women's Hospital. After that, I was, in the middle of job search, and I was about to move to LA when this job at Toronto General kind of came up, and I couldn't pass that opportunity. This is actually a fantastic center. And that's the point back in 2016. Me and my wife, we decided to move to Canada, moved here, joined Toronto General and the program here, and have been with them ever since.
Oh, wonderful. As you mentioned, it took you to through so many different institutions, which obviously gives a very different perspective to the overall thing, right? In terms of how different institutions and all the institutions that you named, they're all in their own way one of the best in the world in terms of where they put. And it's great to know that. And after all that American institutions, you chose the Toronto General one as where you go and land for the last 6 7 years, which is a great great thing to have from being a fellow Torontian or fellow Canadian perspective that you landed with us here. So thank you, Pradipta, for letting everybody know about your journey. And the first question that I thought that we'll discuss two questions today in terms of overall perspective. And the first one is about people who are trying to make some profession out, be a professional in this field, in the medical fraternity field in Canada,
Okay.
and they're planning to come to Canada, or either they're planning to move, or they are in a similar kind of place where you are now, or you were say 10 years back, where they are right now doing that in that phase. So for those people, and we all know that a lot of people are choosing Canada because of its socio structure, the social structure of it, and the way it kind of it kind of welcomes everyone, the society part of it. So keeping that in mind, from a medical fraternity perspective, what would be two or three things that you would recommend people who are looking forward to make their careers in Canada?
All right. So this is what I would say is kind of a broad, at the same time tricky question to answer, because everyone's story is kind of different. Having said that, there's of course the straight and straightforward way that you come and take the Canadian exam, which is called Canadian MLEs. That's how, if you go search in the web, that's how it's kind of mentioned. You take the Canadian MLEs, score well there, apply for whichever specialty that you want to pursue, um, get selected, get trained, and then get a job. Now, there are far more minor and fine points, because one of the issue is, I shouldn't say issue, it's like a good thing if you're a Canadian. That is, Canada really protects their own workers. That means if you are a Canadian citizen or you're a PR holder, you will be given preference. So now you, as an international medical graduate, if you're coming in from outside and you think that you applied for a position or a training position here, that's where the first challenge starts, because Canada does not have that many training positions, because the medical system and medical education is kind of tied along together in this country, because it's part of provincial plan and federal plan. So unlike US, where the number of job positions and training positions are way more, you actually don't have that many positions in Canada. So the Canadian training positions are actually tied to the number of jobs that they have. So now let's say, so I'll just throw you some very approximate numbers. In Ontario, you probably have 5 to 6 universities. So if someone wants to get into medicine, there's probably 10, 15, max 20 positions. Now consider how many Canadian students from their own med school are studying and going to apply for those programs.
Hmm.
In comparison, if you're coming from some other country, let's say UK or US, the number of training positions are actually far more. You'll face similar, if not, different types of challenges. But if you want to get trained and then move to Canada, that's another way that you can do that. So essentially, to answer your question, there's and to like really break it down, there's essentially three ways. One is the published way: take Canadian exams, go apply for Canadian training positions and get to a job. Two is you come trained, you get your training from India or from UK or from US, then move into a training position, or if you have a open position in this country, and then get absorbed.
Okay.
And the third option, which I'm not too fond of, is you come in here, redo your med school, then you belong to the entire Canadian crowd,
The cohort, to the Canadian cohort, actually.
and then go back to step one, get the Canadian training, and then you will get a job.
Hmm.
So what I can say is, if you are trained in Canada, your probability of finding a job, and a good job, stable job, is fairly high. But if one of the problems with how the immigration system is kind of sold is, and I know this for a fact, that it impacted a lot of junior medicos, junior medical grads, that they are given this dream story that, oh, you moved to Canada and you know, all you have to do is get into the training part and then you're all set for life. Visa is not a problem if you just get through the first, hurdle. That story has more details or finer details. It's not so simple. So
Mm-hmm.
that is, I know of a few people who have moved in such a manner and now doing or pursuing research work or some other stuff. I mentor a couple of them at my institution. So what is important in this journey is to have a goal, is to have a plan, and then you stay with your plan. There will be difficulties and challenges, but if you kind of keep up to what you decided that you're going to do this, you will get there. um, it might take you a little longer, or you might see some, you might get surprised with some stuff, but eventually I haven't seen anyone who has stayed his course or his or her course and did not achieve uh, a clinical position or whatever that person wanted to do. It just takes a little bit of resolve, is all I can say.
No, thank you for that. And to be very honest, I speak to newcomers from other areas, which obviously which I have some ideas, and I think it's true for everything in this country because the opportunities are really limited, as you mentioned. The training positions are limited because the population is limited, and that's the reason why the resolve and the preparation
Right.
becomes the most critical piece for anything as such. And I'm sure for something as sophisticated as medical practice, it would be much more because the resolve, the longer period of it, the resolve of it, and knowing the plan that why you have to do what you have to do becomes so important and so critical. And a lot of people, what I've seen for other industries is when they come from, especially Southeast Asia or South Asia, they're not used to planning that way. The system kind of really takes you through, and you're just on the go, and you don't really understand that what you are really, you really don't detach yourself and really plan and then jump into it. You just jump into it, right? And that's a foundational difference that I see.
Yeah, I think that's a more of a culture difference.
Yes.
Like the way we were taught is or trained was go get go take this exam, secure a rank, and you're good to go.
Yeah.
It doesn't matter whether you like that particular specialty or not. If it's one of those coveted fields, you just compete for it, get it, and move on.
Move on. Yeah.
Whereas Western world is, let's say you didn't score as well, but there are still ways if you can show your commitment.
Yep.
Let's say someone scored really average and really wants to be a surgeon. Now that person goes and shows that I have published 2 or 3 papers or research articles, posters. I have worked with this doctor for, whatever, however number of months. I have spent time at this hospital, and this thing that person keeps showing for, let's say, a period of time. People have gotten through with that kind of a application profile,
Mhm.
because scores is just a snapshot of
Yep.
where you are at that point.
Right.
It doesn't define you.
Yeah.
Whereas what you do towards a goal actually is more closer to who you are as a person.
Yeah, no, I think this is such an important one, Prato, because this is a very important piece, and medical fraternity is not something that I am aware of at all. And it's great to know that it's almost the same because at the end of it, the Western world looks at you in more totality
Right.
and in a more rounded way than just one exam and one score
Right.
perspective. And that's the reason why I think on one side it's great, but it's also because of this it becomes very difficult for people from that side of the world to understand that it's not just about one thing or and just jumping into the water and the flow of the water will take you. because that's not how things work.
Yeah, see, the other side of the coin of this approach is, and I have seen quite a few people from, specifically from India, that's who I knew the most. Uh, they have secured excellent scores. Now they applied for some program, and those programs are not interviewing them because your profile doesn't have anything else. All
Right,
you have is scores, and all you have is like 2 or 3 letters, but you are really not into it.
right.
If you can't show that to these programs, that um, you, whatever that you say, like superficial words doesn't really count.
Yeah.
I have been with admissions with residents during my residency program, and now almost for 4 years in recruiting faculties and fellows and residents. So a good 6, 7 years of experience in this space. The thing is, if someone is saying some stuff just for the sake of it, it's very easy to figure out
Figure
once
out.
spend some time in it. So that's where being honest with what you're saying and what you're putting your effort in actually counts. I know these are very cliche words, but this
No, but
actually,
yeah, I think the practicing part of it, right? That you actually practice and you demonstrate how you practice, and not just by saying a couple of words saying that you practice. I think that foundational difference is very important. And it's there for almost all the industries that I come across. And this is the first time I'm speaking to a medical practitioner on this, and it's glad to know that it's the same thing. So, anybody who's watching this video, if you really have more questions on this line, I'm sure Pradipta would be more than happy to answer you or help you out. You can reach out to me, and then I can try to get you connected to Pradipta and try to get you some answers. If you really want to know a little bit more deeper, and if you are yourself going through this cycle, which is just mentioning, where you really do not know you have good scores, but you're not getting the call, you're not getting it, and must be something happening behind which you're not aware of. And getting a mentor like Pradipto, or at least just having a chat would probably help. Moving on to the second part of the question, Pradipto, and the last part of this video today. A lot of us, when we chose Canada as the place where we would raise our families and make it our home. One of the key reasons was the setup of the health system here.
right.
It looked fair. It looked that it was something which fairly treats everybody. It treats everyone equally, and then it also treats based on priority. I've also seen that my own personal experience has been so far. I'm 15 years in this country. Uh, God's grace, have not been able to had to go to emergency too many times. But as many number of times I've been, I have found it to be very, very proactive and very fair. However, we all know the joke is that in Canada, if you really fall sick, the best place to fall sick is a cab, because the chances is that a cab driver is a doctor. So, having somebody from the field, I didn't just couldn't control myself to just have that question in terms of what you see, from your lens, which is up close, right? And we all know all went through the COVID cycle, which kind of jeopardized the whole system everywhere across the globe, and with increased population coming into this country. While we are addressing immigrants on this channel, the immigrants could also have questions on that, right? That in terms of a user of the health system, what do you see? So a couple of points from your side in terms of what you see and how you see it.
So first, so for when we have to talk about a problem, it's important to first agree or disagree if there's a problem or not. This,
Absolutely.
this is a problem. This is an acute problem, not just a problem. This is an acute problem, and all of medical community actually understands that, knows that. I'm fairly certain ministry who essentially funds all the medical side of it, they also are very well aware of the situation. Now it's about connecting the dots,
Mm.
right? Um, and another thing that I would like to first mention is um, I think, and this is something I really believe in, that everyone is good. No one wants to do harm.
Yep.
Everyone wants to help, but then there's reason, then there's means. There's only so much that can be done. So you mentioned that you have been to emergencies a few times in the past. Was that, if I may ask you, was that within the last 2 3 years?
Yes.
And last 2 3 years there was no issues, no
Yeah,
in,
I was surprised. I didn't, because I was there in the last 2 3 years twice. Once for myself, once for my wife, and
right,
in both the cases, I didn't see. I There was nothing that came to me, at least, saying that I didn't like what happened.
right. So now on the same, so the reason I asked you that question is, um, Canadian system, I believe, was meant or built to serve X number of people. Now, this is publicly funded program that has a lot of advantages that you referred to,
Yep.
meaning you are part of Canadian culture. You don't pay for your health, no matter how much it takes. They will take care of you. Triage, if you emergencies, emergency ORs, if you really break down it to dollar numbers, they are actually very, very significant, but you don't pay a dime.
Yep.
That's the beauty of the system. Now, when I say that we don't pay a dime, that doesn't mean we are actually not paying it. We are paying it through our taxes,
That's this.
right? Now, where does that tax money go? Now, I started answering this segment by saying that the system was built for, let's say, um, X number of people. Now, within the last 4 or 5 years, two things have happened. You have seen an acute increase in new population moving to Canada. And when I say new population, that includes young, healthy individuals as well as their parents who are
Right.
probably elderly, who would require more access to healthcare.
Yep.
And the second part is a lot of nurses, paramedical stuff, medical stuff have just left the field because of physician burnout. They just couldn't handle it anymore. Um, a quick little story. When I joined here, I was told, so our work kind of gets, so there are work matrices that we are supposed to do from a lab side. So I was supposed to do like 14, 1500 cases in a year. That was the number that I was quoted. I ended up doing upwards of 2000, 2500 for 3 straight years. So the thing is, if you just, do the math, that's almost 2 times the work,
Mm.
right? Now, these are well and good, well and nice arguments to have. Oh, a physician should give all. But then again, you have to think about the practical aspect of it. How long are you going to be able to do that? And the evidence-based medicine essentially suggests that you shouldn't be doing it. You
Mm.
know why? Because after a certain point, um, your fatigue is bound to set in.
Yeah.
Once fatigue sets in, you're bound to make mistakes.
Mistakes.
And this is a field where your error rates are supposed to be, less than 1% or even less if possible. We don't do that. Medicine has a lot of error rate, unfortunately. But studies have clearly shown that if you're understaffed, that error rate shoots to like 4 or 5%.
Wow.
You're adequately staffed, then that error rate kind of slowly trends down.
Okay.
So now this is the complex picture that I just built for you. Now I think in this given space, um, most of the Canadian hospitals do a fantastic job of triaging where needed. Uh, Now the flip side is, who does the triaging? triagings are done by sometimes junior doctors, sometimes trainees, nurses. Sometimes triaging, even for experienced physicians, is difficult because you probably don't know what really is going on there. And before the patient crashed or something, that's where some of the um, unfortunate stuff that we all have heard probably has happened.
Mm.
And a lot of that essentially boils down to funding, access, enough infrastructure, and enough personnel. If those things are handled and probably hopefully provided in the coming years, you'll see quality of care will eventually trend up. But in the middle, you'll always have that pain part, which is what we are probably going through
That's right.
right now. And we hope, no, I don't think, other than the ministerial group or the people who have the power to make changes, anyone else would be able to give you a straight answer in this. But we all hope that let's hope that the Spain period stays or is as brief as possible for all our sakes.
No, yeah, that would be the wish for all of us, right? And
Right,
it looks like that it's all interconnected, right? The fact that you have lesser training positions, because your training positions are all based on only very limited number of seats, and they're all targeted towards a certain population, and that sudden increase of that population is creating the gap in every single layer. So your supply is much lower than your
right,
demand.
right,
And maybe we'll have another video on the supply and demand story on the housing, but this is a big one, right? Big supply and demand gap between suddenly so many people coming in, and Canada is the fastest growing G7 country right now at 2.5%, right? So keeping that in mind, this is the immediate impact. I think the housing and the medical are two immediate impacts that impacts everybody's lives. And this is great, Pradipta, from your perspective, somebody who is inside it and living it every day, and sharing this wisdom and insight with all of us and all of our viewers. Thank you. And I have been addressing Pradipta as a friend because Pradipta, but Dr. Pradipta Paul. Thank you very much for
thank
being
you.
there today and spending some time with us. And we will reach out for more sessions like this on as things move on and improve. And in the meantime, anybody who's watching this video, if you really want to know a little bit more, and if you are an aspiring medical practitioner in Canada, and if you want to reach out and get some help, please reach out to us. You can reach out to me on LinkedIn, and then I can definitely help you to connect with Dr. Paul. Thank you, Dr. Paul, for this, and thank you, Pradipta, again for taking the time. Thank you,
Thank you,
everybody.
Sanjit, for inviting me over. This is a fantastic endeavor that you are running. I truly believe this kind of information is going to be a lot of help for the newcomers who come in. This is a fantastic.
No, thank you. Thank you so very much for this. Thank you. Thank you for your time.